حاجه بالسي في سي سيستم claudication. هل a patient complaining of any pain in the calves when he walk for a long distance. تمام. مثلا patient يقول لك انا when I walk 2 blocks مسافه مثلا 10 meters احس بالام باقدامي. ف you think about peripheral vascular diseases او other conditions. تمام. هنا لخص لكم آلام الصدر. تمام. I hope it's clear. As a doctor, okay, as a nurse, you don't have to memorize all of it, but يعني زي ما تقولون عيب إنه أنت دكتور إن شاء الله وما تعرف differential diagnosis of chest pain. يجيك البيشنت عنده chest pain, you don't know أو you lost when the patient is complaining of chest pain. في cardiac causes. تمام. أسباب قلبية ممكن يكون بس صمام القلب، تضيق الأبهار أو ارتخاء المترالي. تمام. أو بريكارديال، أسباب أغشية القلب يكون التهاب، أو كورونوري، أو إيورتيك، أو مايكارديال عضلة القلب نفسها، يا إما تضخم يا إما التهاب. So هذول as a causes of cardiac of chest pain. Pulmonary causes: embolism, bronchitis, pneumonia, pleurisy, bronchospasm. تمام. So this is for pulmonary. تمام. If you come to chest pain as a gastrointestinal system, طبعا لازم تعرفون chest pain it can come from cardiac, pulmonary, gastrointestinal, musculoskeletal, neurogenic, psychogenic, others. Many patients when they have chest pain they almost think about cardiac. على طول يقول لك أنا عندي مشاكل بالقلب، أنا ممكن عندي مشكلة بالقلب. ف they don't have knowledge to think about other causes. So as a doctor, you must know these differential diagnoses. Okay, gastrointestinal, we have peptic, ممكن يكون في قرحة والتهاب. GERD, esophageal spasm, gallbladder, pancreatitis. Okay, so this is gastrointestinal causes of chest pain. Musculoskeletal, ممكن يكون rib fracture, ممكن يكون trauma. تمام. ممكن يكون costochondritis. اوكي، التهاب مفصل الغضروف. تمام. ممكن يكون myositis. تمام. So this is musculoskeletal causes. طيب neurogenic causes can be it can be cervical diseases. يكون مشكلة بالفقرات العنق تسبب آلام بالصدر radiating to the chest. تمام. ممكن يكون herpes zoster virus الحزام الناري. Psychogenic causes ممكن يكون anxiety، نوبات الهلع very common to the patients complaining of chest pain. Somatization. تمام. ممكن يكون cocaine induced. طبعا هذول less common لكن هذه very common. anxiety أو نوبات الهلع you will find it very common. تمام. other causes ممكن يكون anemia فقر الدم، أو ممكن يكون severe hypertension. This is shortcut for chest pain. I think it's so clear. Okay, we'll go through the third system, GI. GI, what is the symptoms? Abdominal pain, appetite. You ask about pain in the abdomen, about the appetite, nausea and vomiting, heartburn, dysphagia and uniphagia, diarrhea, constipation, bleeding, and jaundice. Okay, GI is kind of very long history. You take it. Okay, you start by abdominal pain. I will not go through it. Socrates, site onset, character, radiation, associated symptom, and timing of the pain, elevating factors, relieving factors, and severity. Okay. بس هنا very important information اللي هو okay, we'll go through some importance. Yeah, if the pain or if the character of the pain is intermittent, you think about bowel obstruction. If it's stationary, you think about gallstone. الحاجة very important ثانية، هل ال pain exacerbating with food? You think about ischemic bowel disease. If the pain is relieving with evocation, على طول if the patient telling you, doctor, I'm having pain, I'm having abdominal pain and is relieved when I go and defecate. So this is IBS. تمام. irritable bowel syndrome. لكن if the pain is relieved with antacid, you think about GERD or peptic ulcer. تمام. As pain, if it's less than 1 month, this is acute pain. If it's from 1 to 6 months, this is subacute pain. More than 6 months, this is chronic abdominal pain. تمام. هذا for abdominal pain. Appetite, what we have, You ask him about his appetite. Have you noticed any change in your appetite recently? هل لاحظت أي تغيرات بشهيتك مؤخرا للأكل؟ هل تحس إنك تأكل أكثر أو تأكل أقل؟ ليش؟ Some diseases can be diagnosed through the appetite. For example, thyrotoxicosis, malabsorptions. تمام؟ يقول لك البيشنت إنه عندي الأبيتايت الشهية عندي مفتوحة أو الشهية عندي كويسة، آكل كويس، وزني ينقص كثير. Too many patients complaining of this, especially thyrotoxicosis patients. تمام؟ بالرغم إنه يأكل كويس لكن ينقص وزن. الأوبزيت البيشنت اللي ما يأكل كويس شهيته نازلة للأكل مع ذلك وزنه يزود. This is case of hypothyroidism. تمام. You must ask about the appetite and focus on hypothyroidism and thyrotoxicosis. تمام. So this is case of appetite. Nausea and vomiting. Nausea as a causes, GIT causes, we have peptic ulcer, gastric cancer, and so on. Non-GIT causes, labyrinthitis, migraine with aura, renal failure. Okay, this is for noising. GIT causes and non-GIT causes. You must know, I did not give you all the causes. I just give you some of the causes. At the end of the lecture, I give you two books. You must go further and read much deep. تمام. So GIT and non-GIT. Vomiting. How often the vomiting? Hello projectile vomiting أو non-projectile. تسأل عن amount of vomiting. هل الvomiting في GI content؟ يعني إنه البيشنت يأكل للعشاء ويتقيأ، فبيتقيأ إيش؟ الGIT content اللي هو الأكل اللي أكله. تمام. لكن if it's non-GIT content مثلا يكون البيشنت صايم ما أكل حاجة ثم فجأة استفرغ، غالبا راح يكون bile content أو fecal materials. تمام. So this is for nausea and vomiting. Heartburn. تسأله هل في pain أو discomfort بالretrosternal area. تمام. هل هو aggravated by lying down أو relieved by antacid. تمام. Is it associated with saliva, filling mouth? This is caused by peptic ulcer. تمام. So if it's aggravated by lying down or relieved by antacid, what is this? It's GERD. Okay. So this is for heartburn. تمام. Dysphagia and odynophagia. What is the difference between dysphagia and odynophagia? Dysphagia is difficulty in swallowing. تمام. لكن odynophagia يكون فيه pain أو heartburn during swallowing. الديسفاجيا إنه يكون في صعوبة بالبلع فقط. تمام. لكن الأودينوفاجيا يكون في ألم لما يأكل أي حاجة ويحاول يبلع يكون عنده ألم بالبلع. تمام. This is the difference between dysphagia and odynophagia. تسأل عن الديسفاجيا. Is there dysphagia؟ لو قالك عندي صعوبة بالبلع تسأله عن الصعوبة بالبلع هذه. هل هي تكون للliquid فقط أو للsolid أو both liquid and solid. تمام. This is very important. الحاجة الثانية هل في difficulty in initiation of swallowing يعني صعوبة في بدء البلع. تمام. أو there is fluid regurgitation. تمام. لو قال لك إنه عندي fluid regurgitation قاعد أرجع موية أو أرجع سوائل this is case of pharyngeal dysphagia. تمام. هل الفود trapping لما يأكل أكل الفود يحتبس بالإسوفاجس you think about esophageal stricture أو carcinoma. okay. هل الفود trapping لكنه intermittent يعني مرة trap in the esophagus مرة لا كويس. This is you think about eosinophilic esophagitis. تمام. So this is case of dysphagia and odynophagia. تمام. diarrhea تسأل عن how many times do you stool. كيف تشخص الدايريا؟ لو كان stool more than 3 times in the day you think about diarrhea. تمام. How is the stool consistency and the color؟ تسأل عن color of the stool and consistency. هل هو loose أو hard stool? What is the color of the stool? Okay. بعد كذا تسأل عن this is just for your knowledge. Type of diarrhea. Large volume diarrhea you think about secretory cause. Disappear with fasting diarrhea think about osmotic diarrhea. هل الدايريا is fatty diarrhea think about malabsorptions. If it's normal stool but there is increase in frequency. لو قال لك البيشنت عندي أو I stool more than 3 times in the day لكن normal color normal consistency. بس فقط increase in the frequency. It might be increase motility مثل in case of thyrotoxicosis. تمام. Is the stool associated with mucus? لو قالك yes, yeah, my stool is associated with mucus, you think about IBS, IBD, rectal carcinoma. Okay, so this is case of diarrhea. Constipation, almost the same. How many times stool per day? If it's less than 1 time per a day, or less than 3 times per a week, this is constipation. So when you diagnose constipation, if it's less than 1 time per a day, or less than 3 times per a week. Okay, diarrhea if it's more than 3 times per a day. تمام. Chronic causes of constipation: diabetes, hypothyroidism. طيب, bleeding. تسأل البيشنت: did you cough blood, hemoptysis in cases of PE or pulmonary carcinoma? Did you vomit blood, hematemesis? تمام. Did you notice blood in your stool or urine? This is called melana or hematuria. So blood in the stool, this is melana. If it's urine in the blood in the urine, this is hematuria. Okay. You think about peptic ulcer, gastritis, esophageal varices, esophagitis. If it's bright red stool, you think about hemorrhoids. Okay. About jaundice. تسأله: is it associated with abdominal pain? This is case of gallstone, jaundice. تمام. The color of the stool زائد اليورين. If you have dark urine, تمام, and light stool, you think about what? Bowel obstruction. تمام. طيب, if you have dark urine, تمام, and normal stool, you think about hemolytic anemia. Okay, this is 2 cases: dark urine, light stool, bowel obstruction. Dark urine, normal stool, this is case of hemolytic anemia. تمام. This is some hint for you. تمام. لو كان patient عنده peptic ulcer, عادة يكون عنده burning, heartburn, relief by antacid. هذول أنا حطيتها لكم عشان زي ما تقولون تلميحات للأمراض بحيث إنه تسهل لكم الأمر إن شاء الله. لو كان عنده burning, heartburn, relief by antacid, you think about peptic ulcer. أو ممكن GERD بعد. تمام. لو كان عنده pain radiating to the back and steady, relief by sitting, you think about pancreatitis. If the pain is severe and constant and epigastric pain, you think about biliary pain. Okay. If the pain is constant in the renal angio, okay, and radiating to the groin, you think about renal colic. Okay. If the pain is chronic and relieved by defecation, immediately you say IBS. Okay. So this is differential diagnosis, and these symptoms associated mostly with these, these symptoms mostly associated with these differential diagnosis. Neurology. I'm going to take a break for 2 minutes, only 2 minutes, and then I'll be back. I'll drink some water. Thank you. Okay, let's continue. Is everything before clear? Respiratory, CVC, GI, it's clear, right? We're going to go through neurology, and we're going to go deep through headache. يا جماعة أنا أقول لكم الهيدك very important لأنه almost كل عوائلنا يشتكون من الصداع. فحتى أنت كميديكالز لازم تاخذ history of headache بشكل كويس وتعرف تفرق بين التايبس of headache. تمام. Let's go through neurology الحين إن شاء الله. بعد كذا go through headache. تمام. So neurology, as a symptoms, we have headache, body and facial pain, numbness, faints أو fits, disturbance in vision أو hearing أو